Hi everyone, hope you're doing well. Dr. Samina Mitha here, naturopathic doctor, and today I'm talking about skin signs of insulin resistance. A lot of times I'm told that I've gone blood work and I've looked at it with my family doctor or naturopathic doctor and everything looks normal. It doesn't look like I have insulin resistance. And this can be the case often when we just test fasting insulin and fasting glucose. We might not see insulin resistance from that. Doing an oral glucose tolerance test may help us, but that will only show us the glucose side of things. It won't show us insulin. So doing an insulin glucose challenge test can really help show us if insulin resistance is present if we're not seeing it on a fasted state with insulin and glucose. So that's one thing to consider. The second thing is physical signs of insulin resistance. Our body gives us clues as to what is really going on the inside. And I've found that through the research and what we know about insulin resistance is that there can be skin signs related to insulin resistance. And so if you have any of these signs and symptoms related to PCOS or just in general, you should really consider thinking about insulin resistance and getting some support with this. The number one sign I would say is acne, cystic acne. This is a very common symptom in PCOS. And if you have cystic acne, whether it's on your face, your chin, your jawline, on your chest, the back, this can be a sign that insulin resistance is present. Especially because insulin resistance increases testosterone in our skin, and that's where we start to see the signs of acne. So very important to consider insulin resistance when we have a symptom of acne with PCOS. But there's some other symptoms that aren't talked about as much, and so I want to talk about those today. The one symptom that I commonly see is skin tags. So these are raised, when your skin gets raised and it almost looks like a flap. Excuse me, I need some water. A flap on your skin, and you can kind of move it around. This can be a sign of insulin resistance as well. So skin tags, it can be the color of your skin. It can even be a little bit darker. So if you see and oftentimes it's on the neck. So you will see when the skin tags appear on your body that we do see more often on the neck area. Another one is darkening of the skin, especially in the skin folds. So oftentimes you'll see it like in this area. If you like put your neck down, even like where the creases are, that's where we commonly see this. In pregnancy for me, my skin got very dark, even postpartum. And so I think my insulin resistance was getting worse. And the reason why I'm saying I think because we didn't do any lab work to really figure it out. But definitely if you have darkening of the skin in your neck area, in your underarms especially. A lot of people think that if they shave that their skin is getting darker because of that. It actually could be related to insulin resistance. So getting that checked out is important. I just realized I haven't taken a sip of my water even though I was losing my voice. So give me 1 second here. Okay, so darkening of the skin, especially in the neck, in the underarms, in the groin area. I've had this patch of like darkening of skin and the inner thigh, and I remember as a child I had this and going to the doctor and them telling me that it could be from the chlorine from the water. But now it makes so much sense that I just always had blood sugar issues and I was always more prone to higher levels of glucose in the body. And that's a huge sign that insulin resistance could have been present for me as a child too, which is crazy. Another thing is hair loss. So hair loss is a symptom we see in PCOS as well, also related to insulin resistance. So when we're treating hair loss in PCOS, we're looking for is insulin resistance present and where is the hair falling out. Typically it's in this like frontal part here, just behind the hairline, and it can be that the follicle is coming out, so you're actually seeing like the bulb of the hair at the very end, and that means that testosterone could be present in there, causing the full follicle to be released. So hair loss, darkening of the skin, skin tags. Another skin sign of insulin resistance is boils, or something called hidradenitis suppurativa. This is when you start to see those very big cysts that can occur anywhere on the body, but oftentimes we've seen in the groin area, underarms, sometimes on the face. These are really painful, deep, cystic boils that, oftentimes you don't realize that it could be related to insulin resistance, but it is. One time for me, I've only had this once, but I remember this very clearly. It was after Thanksgiving, so I probably ate too many carbohydrates that year and really impacted my insulin resistance, and I ended up getting a really big boil in my underarm, and I had to get it surgically cut so that it can be released. And I found that realizing after the fact that this was probably insulin resistance creeping up on my body and not even knowing it, because my fasting insulin has always been normal. But again, when we challenge the body with the insulin glucose challenge test, that's when we end up seeing the insulin resistance. So another sign of insulin resistance. I hope this kind of gives you a little bit of clarity as to what else to look out for if all your labs look normal. I just sent a newsletter out on this topic as well. If you're interested in more newsletters like this, please sign up below. I'll put the link in the bottom. You'll also get my free PCOS food cheat sheet. And I just wanted to tell you a little bit about this webinar that I'm holding next month. It's on June 14, 6:30 p.m. Eastern Standard Time. I'm talking about 3 ways to rethink your PCOS. I'm really excited about this topic because I think there's definitely ways to really understand and rethink our PCOS that we might not be thinking about or that you may not be thinking about in the past. So join me on that as well. I'll post the link below for you to join that webinar. It's June 14th, 6:30 p.m. Eastern Standard Time. I'm talking about 3 ways to rethink your PCOS. See you then.